Hello, good to be back again. Today I will give an overview about knee osteoarthritis. What is knee osteoarthritis? Knee osteoarthritis is a condition or degenerative condition of the knee which is characterized by thinning of the joint surface. For example, you can see over this model, thinning of the joint surface and lead to expose of the bone, or we call exposed subchondral bone, subchondral cyst. There will be a cyst below the joint surface, and also you can have a bone spur. You can see this is a bone spur over the knee joint. Then, what are the symptoms of the knee osteoarthritis? Number one, there will be a pain over the knee joint, and it is described as a mechanical pain. The pain occurs during prolonged walking. Second symptom, the patient experience stiffness during or after a prolonged rest. This is because of the joint capsule of the knee is contracted. The third symptom will be grating sensation, or the patient will describe to the doctor he or she has a cracking sound or grating feeling over the knee joint. The last symptom will be swelling. What are the risk factors of the knee osteoarthritis? Number one, older age. Most common occur at the older age. Number two, obesity. Obesity will predispose a person to have a knee joint osteoarthritis because the body or the load transfer across the knee joint is higher compared to normal people. It can be due to other problems such as injuries, such as ACL tear, which is lead instability to the knee joint and increased joint forces across the knee joint. It can be due to meniscus tear, which lead to loss of shock absorber of the knee joint and lead to increased stress over the knee joint and lead to joint surface degradation or thinning of the joint surface. And very rare causes, certain metabolic disease such as gout and a person with too much iron in the body, which is hemochromatosis, also predispose them to have knee osteoarthritis. Genetics, patients who were born with skeletal or knee deformities or congenital condition with a bowing knee joint. In this particular patient, there will be abnormal transfer of the load across the lower limb, which is increase the stress over the knee joint. And last, genetics. Some patients inherit a tendency to develop knee osteoarthritis. Next, how a doctor or orthopedic surgeon diagnose a person with knee osteoarthritis. Normally, the doctor will perform physical examination. They will identify if there is a deformity, or we call genovarus or genovalgus over the knee joint. Then they will elicit tenderness across the knee joint, and they will identify if there is a swelling over the knee joint, and then doctor will assess whether the range of motion of the patient is limited or within normal range. Then the doctor will order an x-ray. The doctor will look at the evidence of knee osteoarthritis. There will be a narrowing of the joint space, bone spur, and subchondral cyst. An x-ray, normally the doctor will grade the knee osteoarthritis. It can be grade 1, grade 2, grade 3, or grade 4. It means grade 1 is the least serious and grade 4 is the end stage knee osteoarthritis. MRI is not necessary, or if the doctor suspect the patient have a knee osteoarthritis. They will only embark if they suspect the problem not due to the knee osteoarthritis, probably due to the degenerative meniscus tear or other problem. Next, the doctor will do a blood test if they suspect the knee osteoarthritis due to other problems such as autoimmune disease. They will order investigation to check the autoimmune marker. Next, they will send to look for high in uric acid or hyperuricemia to look for any evidence if the patient have a gout problem. And some doctor, if the effusion or the knee joint swelling is too large, they will do aspiration or remove the fluid from the knee joint to look at the condition of the fluid, and then they will send for a further analysis, especially to look if presence of infections or presence of gout crystal.